echocardiographic deformation imaging for early detection of genetic cardiomyopathies. Karim Taha and Fedo Kirkles. Department of Cardiology, Circulatory Health Research Center. Clinical screening of the relatives of patients with genetic cardiomyopathies is important, as they are at risk of developing a similar disease as the index patient. However, clinical screening of relatives is complicated by incomplete disease penetrance, which means that not all relatives develop the disease, and varying expression. Besides, they often lack clear signs and symptoms at presentation. Life-threatening adverse events can already occur in these early stages of disease, so sensitive tools to reveal the earliest signs of disease are needed. Cardiac imaging has a major role in genetic cardiomyopathies. Unfortunately, conventional imaging modalities often lack sensitivity to detect early disease in relatives without overt disease expression. Over the last decade, deformation imaging has emerged as more sensitive compared with conventional imaging for quantification of cardiac function. This may reveal subtle changes in the early stages of many cardiac diseases. Echocardiographic two-dimensional speckle tracking is the most commonly used tool for myocardial deformation imaging. Speckle tracking allows visualization of global and segmental cardiac deformation patterns throughout the cardiac cycle. The technique is particularly attractive for routine clinical use because of its non-invasive nature, wide availability, and low cost compared with other imaging modalities. The utility of echocardiographic deformation imaging for early detection of genetic cardiomyopathies has been explored in multiple studies, but the technique has not been broadly implemented in routine clinical screening in the cardiogenetics department. We have performed a systematic review to evaluate current evidence on the use of deformation imaging in screening of relatives, and to identify knowledge gaps. The search was conducted in the Medline, Embase, and Cochrane databases. The search queries included keywords and synonyms for deformation imaging, and the most common genetic cardiomyopathies, including dilated cardiomyopathy, hypertrophic cardiomyopathy, arrhythmogenic cardiomyopathy, and non-compaction cardiomyopathy. After applying the inclusion and exclusion criteria, 29 studies were included, all published between 2009 and 2021. 6 studies were performed in dilated cardiomyopathy, 11 in hypertrophic cardiomyopathy, 11 in arrhythmogenic cardiomyopathy, and only 1 in non-compaction cardiomyopathy. The findings with echocardiographic deformation imaging that are reported in relatives of dilated cardiomyopathy patients are reduced global longitudinal strain, regional postsystolic shortening, and reduced left atrial strain. Reduced global longitudinal strain was associated with ejection fraction deterioration, hospitalization, and mortality. Regional postsystolic shortening was associated with ventricular arrhythmias in phospholamban mutation carriers. In relatives of hypertrophic cardiomyopathy patients, reduced basal septal strain and alterations in left ventricular rotation were most commonly found. Global longitudinal strain was preserved in the early stage. Early detection in relatives at risk for arrhythmogenic cardiomyopathy is of particular interest because these relatives are at risk of developing life-threatening ventricular arrhythmias before the onset of overt structural disease. Early signs of disease in relatives of arrhythmogenic cardiomyopathy patients were reduced right ventricular free wall strain, increased right ventricular mechanical dispersion, alterations in regional right ventricular deformation, and alterations in left ventricular deformation. Only one study investigated non-compaction cardiomyopathy relatives. Many conventional and deformation parameters were slightly more abnormal compared to controls, but these findings are not replicated up to this moment. Multiple deformation parameters are available, but the main findings reproduced by the different studies are reduced global strain in relatives at risk for dilated cardiomyopathy, reduced basal anteroseptal strain in relatives at risk for hypertrophic cardiomyopathy, and reduced right ventricular free wall strain in relatives at risk for arrhythmogenic cardiomyopathy. With regard to risk stratification, the prognostic value of deformation imaging has most extensively been investigated in dilated and arrhythmogenic cardiomyopathy, showing a benign prognosis when deformation abnormalities are absent. Considering the high negative prognostic value of deformation imaging in the available studies, relatives who have normal findings by deformation imaging may be offered lower follow-up intensity than relatives who have subclinical deformation abnormalities. To summarize, screening of relatives of patients with genetic cardiomyopathies is important but challenging. Deformation imaging on top of the standard clinical workup reveals early signs of disease in relatives. These early mechanical abnormalities have prognostic value in dilated cardiomyopathy and arrhythmogenic cardiomyopathy, and may be used in these relatives to tailor follow-up protocols. Long-term follow-up studies of large cohorts are needed to determine the value of echocardiographic deformation imaging for predicting life-threatening adverse events in relatives of patients with genetic cardiomyopathies. Echocardiographic deformation imaging for early detection of genetic cardiomyopathies, JACC Review Topic of the Week.